intermediate tunic or middle coat or uveal tract. It is highly vascular and pigmented and often called the uveal tract, since after dissecting the sclera, the exposed intermediate tunic resembles the skin of a dark grape which surrounds the jelly-like contents of eye. The intermediate tunic consists of behind forwards of three parts: choroid, ciliary body and iris. Choroid. It is sandwiched between the sclera and retina, chocolate or dark brown in color. The choroid lines the posterior 5/6 of the eyeball. Posteriorly, it is pierced by optic nerve, where it is adherent to the sclera and is continuous with the pia and arachnoid matter. Its external surface is separated from sclera by suprachoroid lamina, which is composed of loose network of elastic and collagen fibers and is traversed by long posterior ciliary vessels and nerves. Internally, the choroid is firmly adherent to the pigmented layer of retina. Now we will see structure of choroid. From outside inwards, it presents the following layers. First one, suprachoroid lamina, which is known as lamina fusca. Second one is vascular lamina. It is a layer of blood vessels with scattered pigmented cells in the supporting connective tissue. The arteries are derived from short posterior ciliary arteries, and veins converge inwards to form 4 or 5 varicose veins which pierce the sclera and drains into ophthalmic veins. Third is a capillary lamina or coroidio capillary layer. It is fine network of capillaries which nourishes outer 3 or 4 layers of retina. Fourth one is basal lamina, which is known as membrane of Bruch. It is a thin transparent membrane to which the pigmented layer of retina is firmly attached. In some animals, specialized cells of choroid form a reflecting area known as a tapetum, which produces a greenish glare in the eyes of some animals at night. Functions of choroid: provides nutrition to outer layer of retina, supports the retina, absorbs the light, prevents the reflection. Now we'll see about ciliary body. The ciliary body extends as a complete ring from the anterior part of choroid at the ora serrata of retina to the periphery of iris at the sclerocorneal junction. It provides attachments to the suspensory ligament of the lens and peripheral margin of the iris. Being thicker in front and thinner behind, the ciliary body is triangular in section, which is apex directed posteriorly to join choroid. Its outer surface is in contact with sclera. The inner surface is divisible into two annular zones, pars plicata and anterior 1/3, the pars plana in posterior 2/3. The pars plicata present 70 to 80 ciliary processes which radiate meridionally from the periphery of the iris. The elevations of the processes rest in the grooves on the anterior surface of the inner ends of ciliary processes project into periphery of the posterior chamber of eye and secretes aqueous humor. The pars plana or ciliary ring is limited at periphery by ora serrata. The short anterior surface or base of the triangular ciliary body gives attachment to the periphery of the iris near its center. Structure of ciliary body. It consists of a stroma, ciliary muscles, and bilaminar epithelium covering the inner surface of entire ciliary body. Ciliary stroma includes suprachoroid vascular and basal lamina of choroid. It consists of loose fasciculi of collagen fibers which support the ciliary vessels, nerves, and ciliary muscles. The arteries are derived from the long posterior ciliary arteries, which break up into intricated fenestrated capillary plexus in the capillary processes. At the periphery of the iris, the arteries form major arterial circle. The veins join with the varicose veins. Ciliary muscles. It is unstripped and consists from outside inwards of three sets of fibers: meridional, radial, and circular. All fibers arises in front of the posterior surface of the scleral spur. Actions. When ciliary muscles contract, the suprachoroid lamina and ciliary processes move forwards. Eventually, the suspensory ligament of the lens is relaxed due to release of contact pressure. This allows bulging of the lens to adjust the eyes for near vision. Hence, the ciliaries acts as muscle of accommodation. The ciliary muscles has no opponent. As the muscle relaxes, elastic recoils of suprachoroid lamina makes the suspensory ligament tense, which results in flattening of the lens for adjustment of distant vision. Nerve supply. Ciliary muscle is supplied by the parasympathetic nerves. The preganglionic fibers arises from Edinger-Westphal nucleus of the oculomotor nerve in the midbrain are relayed into ciliary ganglion. The postganglionic fibers reaches the eyeball as a short ciliary nerves. Iris. Iris is a circular, pigmented, and contractile diaphragm that is immersed in aqueous humors between the cornea and the lens. Its peripheral margin is attached to the anterior surface of the ciliary body, and near its center there is a circular aperture, the pupil. The pupil represents the rim of developing optic cup. The iris is not a flattened disc, rather resembles a flattened cone truncated by the pupil because of the anterior surface of the lens pushes it a little forwards. Anterior segment of the eyeball is divided by the iris into anterior and posterior chambers, which are filled with aqueous humor and communicates with each other through pupil. The anterior chamber is bounded in front by the cornea and behind by anterior surface of the iris, and opposite the pupil by anterior surface of the lens. The chamber is limited at the periphery by iridio-corneal angle, which is known as angle of filtration, from which aqueous humor is collected into sinus venous through the space of trabecular tissue, which is known as a spens of Fontana. The posterior chamber is bounded in front by posterior surface of the iris and behind by the lens and its suspensory ligament. Inner ends of ciliary processes project into periphery of the posterior chamber and secretes aqueous humor. Structure of iris from before backwards. First one, anterior surface of iris is not covered by a distinct endothelium. It presents excavations known as crypts and an irregular fringe, the collarate, which represents line of attachment of pupillary membrane in the fetus. An anterior border layer is formed by a layer of branched fibroblast and melanocytes and blends at the periphery of iris with the pectinate ligament derived from Descemet's membrane of cornea. Second structure is stroma of iris. It contains collagen fibers, tissue spaces between them, fibroblast and melanocytes, vessels and nerves, sphincter and dilator pupillae muscles. The stromal space are in free communication with the fluid of anterior chamber. The sphincter papillae is an annular band of a smooth muscle in posterior part of stroma and encircles pupil. The fusiform muscle cells are arranged in group and are enclosed by sheath of collagen fibers in front and behind. It developed from ectoderm and supplied by the parasympathetic fibers from oculomotor nerve by way of short ciliary nerves. The pupil is constricted when the muscle contracts. The iris contracts reflexly when light reaches the retina, which is known as a pupillary light reflex, and during adjustment of eye for near vision, which is known as accommodation reflex. A drop of atropine in the eye dilates the pupil with loss of accommodation because the drug annuls the action of sphincter papillae and ciliary muscles by blocking the action of acetylcholine on the effector cells. The dilator pupillae consists of smooth muscle fibers that radiate from collagen sheath covering posterior surface of sphincter papillae at the periphery of pupil. The muscle lies immediately in front of the pigmented epithelium and is derived from myoepithelial cells, hence the muscle is ectodermal in origin. The dilator pupillae is supplied by sympathetic nerves. The preganglionic fibers are derived from lateral horn of T1 and T2 segments of spinal cord, and the postganglionic fibers from superior cervical sympathetic ganglion reach the muscle through ciliary nerves. The iris derived its name from the Greek word rainbow because its various shades of colors. The color depends on arrangement and the type of pigment on the texture of stroma. In brown iris, the pigment cells are numerous, and in blue iris, the pigment is scanty. The blue colored is due to diffraction and resembles the color of the blue sky. In albinos, pigment is absent in both the stroma and epithelium, and pink color of iris is due to blood. The pupil appears black because the rays of light that are reflected from the retina are refracted by the lens and the cornea and go back to the source of light. A cleft in the iris extending radially from the pupil is known as a coloboma. It is congenital defect and represents a remnant of choroid fissure. Third structure is pigmented epithelium. It is known as the pars iridis retinae, which consists of two layers of pigmented epithelium and is derived from the anterior part of developing optic cup. The epithelium curls forwards around the margin of pupil and forms a black circular fringe. Blood supply of iris. First, arteries. At the periphery, the iris, rather within the ciliary body, a major arterial circle is formed by anastomosis between two long posterior ciliary arteries and anterior ciliary arteries. From the major circle, vessel passes centripetally and anastomose closely to the pupillary margins to form minor arterial circle, which may be incomplete. The vessels are non-fenestrated and without any elastic lamina. Veins accompany the arteries and drains into varicose veins. Nerve supply. Parasympathetic nerve supply the sphincter papillae, sympathetic nerve supply dilator papillae and blood vessels, and long ciliary nerves from ophthalmic nerve convey the sensory fibers. Applied anatomy related to this vascular tunic are vascular congestion of a circumcorneal plexus may be due to the following reasons. 1. In conjunctivitis, the superficial vessels of bulbar conjunctiva are dilated. The redness increases towards the fornices and does not fade on pressure. The vessels move with the conjunctiva. Second reason is the deep vessels of circumferential plexus are dilated in disease of cornea, iris or ciliary body. This results in a rose pink band of a ciliary injection which disappears on pressure, and the vessels do not move with the conjunctiva.